Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine for our patients, our members, and the communities we serve. Thanks for tuning in.
Hello and welcome back to the POMA podcast series. I'm here today with Marissa and Dr. Roth. My name is Medha Koti. I'm OMS 1 at LECOM Seton Hill. And if you both would like to introduce yourselves.
Hi, I'm Marissa Tumez. I'm a second-year osteopathic medical student at PCOM.
And I am Dr. Valerie Roth. I am an ENT surgeon in Western Pennsylvania. I've been practicing for 30 years now. Graduate of PCOM, did my rotating internship back there, which was an awesome experience, and my residency at PCOM, my general surgery at UMBNJ. I then spent time with the military, paying back my HPSP scholarship at Fort Belvoir, Virginia, and Walter Reed Hospital. Moved to Western Pennsylvania, where I'm from, and I've been here the past 22 years.
Awesome. So we're here today to basically talk about our experiences with NOM Week, which is the National Osteopathic Medicine Week, and our experiences with DO Day up on the Hill, as in Capitol Hill, Washington, D.C., which we were all at last week. So I guess we can start with just talking about why we're all interested in osteopathic medicine, me and Marissa as students, and then Dr. Roth as a practicing doctor of osteopathic medicine. So Marissa, would you like to start? And then we can come back around.
Yeah, sure. So I'm sure as most pre-med students kind of go through, they don't really know what osteopathic medicine is. But when I was doing my research, I knew I wanted to do osteopathic medicine education because it was patient first, preventative medicine, education, and I knew I wanted to do primary care and take care of patients in the long term and not just look at them once, but look at their, again, whole body, holistic, all those buzzwords for osteopathic interviews that you might be using in interviews. So I went through that route. I toured PCOM and I honestly just fell in love with PCOM and I thought it was the perfect environment for me to thrive in a very tough 4 years of my life. I felt very comforted and I knew that if I'm going to take care of myself, I can be able to take care of patients. Now, being an osteopathic medical student, I am so happy to have learned these extra skills I have through my education. My professors are just so wonderful. PCOM especially has a really rich history, like just osteopathic medicine. We're celebrating 125 years this year. But other than that, as osteopathic medical students, we really do advocate for patient health. And it goes more than just our borders of medical school. We go out into different parts of Pennsylvania, and we go to Washington, D.C., and we talk to
literally everyone.
Yeah, but we just talk to congressmen and their staff. But it's really awesome to be able to tell people what osteopathic medicine is. And I feel like there is no other way to learn medicine, especially if you want to develop a really personal relationship with your patients, care of them. And plus, the OMT is especially helpful. We'll say like a card trick in the back of your pocket just to have when you're treating your patients. But other than that, I can go on forever about it. That's just the basic summary.
Dr. Roth.
So I recently was labeled with the term legacy DO, and I never thought about that before, but my dad was an osteopathic physician as well, and his forte was osteopathic manipulation. So when I was looking at medical schools back in the day when he was practicing, DOs, especially back then, were not well known and they were considered second-class citizens. So he kept begging me not to be a DO. But I had seen manipulation in practice, and that was something that I had to have. I had to know how to do that. The other thing I didn't realize at the time, but now when I look at my practice and talking with people, I realize that I incorporate the holistic approach. And I saw my dad do that. You didn't put a finger on it. He didn't say oh, watch what I'm doing. I'm going to show you how to be a holistic physician. But that's what he was and, who I modeled after. So it just made sense coming into osteopathy. And that's why I'm an osteopathic physician. I did end up specializing. I planned on being a family practitioner coming in with my dad, but that's not the path I ended up taking. And as far as advocacy, I don't know if you want to jump there yet or.
Sure. We can keep doing little loops around.
Then you go and tell us why you chose osteopathy.
It's all the same stuff that you guys have been saying. Basically, I've had a lot of patient experiences throughout my original healthcare experiences. I worked at the Hopkins Hospital for a while back in high school, and then again during college. I went to Jefferson and Philly, so I saw a lot of the inner city hospital stuff there. Worked with NODA there. So it's I realized when I was looking into what kind of a medical school education that I'd like to basically go through, I identified a lot more with the idea of osteopath and holistic medicine, just within my own interactions already. It's just I'd never interacted with a person looking for one problem to fix. It was more finding all of these different aspects of a person and putting it together to get this complete picture. And then going about not just treating them, but caring for them from that point onwards. And with OMT, when I'd first learned about it, I kind of had the same reaction as you did, Dr. Rosberg. I was oh, I gotta learn that. I want to get really good at it as well. And it's a huge learning curve, which Marissa, I'm sure you had to go through, especially as a year too. It's a lot of new concepts. It's, there's so much information to pick up, but once it starts clicking, it's a beautiful art, another tool in your toolbox that you get to use and apply to patients that come in with all sorts of complaints. You have something for almost everyone. And we learn about all of these different ways to assess based off of what a patient comes in with, what sorts of treatments are appropriate for them, so that there's something OMT-wise that is pretty much applicable to every single person, which is I think one of the best parts about just learning that as a skill. You can find something for everyone. And it's nice to know that regardless of whatever specialty that I end up going into, because I'm so early on in this medical pathway, that I'll probably be able to apply that learning to whatever it is that I'm doing.
I want to add, I think a lot of people, especially if they're pre-meds, they think osteopathy is more so focused on primary care medicine.
Mm-hmm.
But so far from the truth, because Dr. Roth, here you are, you're practicing osteopathy in your surgery practice, and it is a philosophy. It's not just using OMT on patients, which again is an added bonus, but it's more so looking at the patient. I actually just finished my osteopathic principles class and practical, and my last practical and exam today. So I've had a lot of reviewing recently, but with every class we take, we have an osteopathic related course. So again, I did my MSK course or my musculoskeletal course, and we went into kind of the mind, body, spirit of someone who has psoriasis or rheumatoid arthritis, and looking at their mental health, and making sure you're checking in with that, and looking at what's best for them treatment wise. And that's not always medication or not always steroids. So it's really cool that we have osteopathic professors teaching us that directly, so that we're following that approach of the philosophy all the way through in every part of treatment as future physicians.
It's also something that you can meet people who are a little more apprehensive or worried about specific types of treatment. It's an easier one to introduce them to, especially because we do have a lot of people that practice in rural areas, people that are PCPs, where they're working with patient populations where medical literacy might be a little lower. And so just to basically bridge that communication barrier that other physicians might have with those sorts of patients, it's a great approach. And also with OMT, it's another tool to basically use to connect with them better. And that's just the best stuff.
Yeah. I was impressed with the new professors from Duquesne. They came and spoke at District 8 conference, and their holistic approach in their specialties was just awesome to see it applied in even the specialties.
I'm not sure what sort of case-based learning you guys have as well at PCOM. I'm in a case-based learning program, basically. Problem-based learning is what it's called. And we go through cases where we see that approach being worked within how we go through the case. And that's always a really cool thing to see. But how about we switch over to talking about DO Day on the Hill? And if you guys want to basically explain why you were interested in going to the event in the first place, any memorable moments, some of the benefits of attending, just getting more information out there about what DO Day is all about.
I got involved with POMA, the Pennsylvania Osteopathic Medical Association, about 3 years ago, and it has just changed my life. it's an amazing group of people that are involved with it. And there's so many facets about it. So we're looking at improving education for the students, for the residents, for people who are already out there, for retirees. We're looking to include military people from the state of Pennsylvania. Communication with the communities is a piece of it. Advocacy is a huge pillar that we look at. And just as I listen, I get more and more like sucked into the advocacy because I'm like, yes, somebody has to step up and take the time to say, some of these things are not right and we need to change it. So I went last year. It was the first time I ever went. It's challenging as an attending. It's challenging at any level. And I super have kudos of respect for you guys that came as students, because I know that was hard to juggle into your schedules with all your exams and everything. So really appreciative that you are looking to the future and starting now, which is just amazing. But as an attending, you're now taking time off of work, which is bottom line dollars and cents. So I think it's really hard to get people to come participate, but we all need to start participating. When I went last year, I didn't have as many people with me. So I was solo when I was going to the Congress people's doors, and we went as a group to see the senators' offices. But when I went in, every single office welcomed me in and found someone to talk to me, even if I wasn't their specific constituent. And they were so appreciative to have constituents show up. They're like, you don't have any idea how meaningful this is, that you actually took time out of your life to come here. So we know how important this must be to you. So that like got my fire flamed up. And so I was obviously back again this year. And it's amazing the people that you get to meet even within our own organization. And hopefully lifelong friendships have been forged. And the alliances that we're building to help promote our profession, not just for us, but for our patients as well. And like, I could hear that in all the conversations that I had with you students, like, wow, they're here because they care so much about their patients first and the profession. That's my little take from this year.
And I think an important thing to note as well is we can go maybe after we go around into some of the things that we talked about with the congressmen in relation to this year specifically. And then if there's anything you want to mention from last year. But one of the things that really struck me is that even though we're going to basically educate people about what osteopathic medicine is and how it, benefits our patients and what we need to improve both the physician practices as well as patient care, we're also talking about things that benefit everyone within the healthcare industry. Like we can come back to this, but the SAVE Act applies to everyone. The, Medicare HR 2474, I believe, that act, when we were talking about that, it applies to MDs as well. We're going out there as a minority, quote unquote, within the healthcare industry, but advocating for everyone, which is so important. And like, it just fills me with a lot of pride, for all of the DOs that showed up that day.
I think that stems back once again to the philosophy of osteopathic medicine. Like, it is preventative medicine, education. It doesn't just go on between a patient and a provider. It's also among like family members, and then like caregivers, and also healthcare workers, and also your senators and everything. So it just like fits perfectly into, like osteopathic doctors doing this not only for themselves and their business, but also allopathic doctors and literally anyone else that medicine could ever apply to, which is everyone.
And Dr. Roth, you mentioned you weren't necessarily the constituent for certain people that you were like speaking with. And that's something that I experienced basically for the first time going this year, because I was born and raised in Maryland, just 40 minutes out of DC. But I've been in Pennsylvania now for schooling for about 4 years almost. I went as a representative for Pennsylvania, but I got to speak with, in our last meeting, if you remember, basically someone that has also been raised in Baltimore and like around that area. And there were so many people on our team as well that had either been raised in Pennsylvania or they were raised elsewhere and they were coming to represent Pennsylvania. And just the, I guess, cross sections between all of the people that have, lived one place and they've worked somewhere else, or they've gone and, attended school in one other place. It's like we see how interconnected everyone's careers are, and how it's not just like one state is missing this thing and one state is missing this thing and this state wants this thing. It's like we really unify all of the DOs and all of the people in the healthcare industry across the country, which was a really like lovely thing to see. That was really cool. I mean, like within our own team, we had a student who was from Arizona. We had a student that I think she went to school in Tennessee now, but she was from the Pittsburgh area. So it's just like people from all over that you get to meet. And it like reminds you that even though it's like, there's a statistic that says, I think currently like above 11% of physicians are DOs, how many of us there are when it's even just like a small fraction of us that got the chance to take some time to come and show up. It's really cool.
It was awesome.
Yeah. So how about we talk about some of the key points that we discussed at this DO Day specifically? And then if you want to mention anything from previous years, is there anything that you were particularly passionate about or that you really enjoyed educating people on, whether it was the congressman or other people who maybe saw our white coats and said, what are you here for? What do you do?
I can talk a little bit about, I guess, actually both the Ready and CVAX. Actually, they all go into this, but so one of the statistics that we were really presenting to all congressmen is the fact that I think 40% of rural medicine providers are osteopathic doctors. And here we are as osteopathic medical students and doctors and advocates coming in and talking about some like health disparities that they have with both like finance and also finance and reimbursement, but then also with like payment. And then because there are fewer doctors in rural communities, that puts a higher strain on physicians and it has a higher demand on the patient-provider relationship. So the Ready Act was proposed to help students going into residency defer their student loan payments just for a little bit longer, basically to help with their finances and also in the careers that they want to choose. And that, again, being with the fact that there are fewer doctors in rural communities. They are mostly primary care, so no major hospitals around there. And they're also not HMOs or big corporate organizations working for, so they are expected to make less money. And as a medical student, when you're applying to residencies, you have to look at your loans. So you have like a lot of loans to repay. You're like, okay, maybe I shouldn't be going to, this rural town that I've always wanted to go to as a little kid and serve. Like, I need to think about my life and my career. So the Ready Act, it would help medical students / residents decide where they want to practice by alleviating some of the financial burden that they have and not take away the passion that they have for their patients.
That was like a really big talking point within our own team as well, where we had a student who was basically explaining that he has a lot of friends at his DO school who are very passionate about primary care. They love working with that family practice setting, but they have to basically weigh in the amount of debt that they've accrued over the years of just being in training and compare that to how much that they make serving in like a rural underserved area. And it's like studying medicine is very expensive, but you shouldn't be punished for wanting to be a PCP, especially when we have such a significant primary care physician shortage, let alone just a national physician shortage across all specialties. And that's obviously been a very core part of osteopathic medicine, is going back to grassroots communities, which is something that a lot of the congressmen that we met with were very passionate about as well.
I think it's just amazing too. One of the statistics that they told us about the amount of money that it costs to pay back your loans during residency is about 30% of your overall salary.
Yeah.
That's like insane. So we were just asking, hey, couldn't we put the interest on hold while people are in their residencies to allow them to continue to choose these career paths? So that one we actually asked for last year too. So that one didn't make it through last year, but maybe this year.
We charge crossed. And I think that's like a very lovely part of the stuff that we are advocating for, is that we find these very like critical problems and we try to find a very practical solution for it and advocate for that, which is that, a lot of times we were clarifying with the congressman that it's not necessarily going fully for the loan forgiveness, but trying to find these like small steps that we can take, like deferring the interest accruement, so that we can basically start chipping away at these issues that we have within the healthcare industry in general. How about we talk about the SAVE Act? Dr. Roth, would you like to start us off there?
Sure. So the SAVE Act, it's really almost like so basically logical to ask for this. But yet, if you think about it, it's complicated. So what we're asking is that Congress puts the same value on the lives of medical workers as they do to the airline staff, and put some limitations on people being accosted at work. Right now, healthcare workers, the attitude is kind of, that's part of the job. You got to expect that in medicine. I'm not saying it's going to be easy because there's going to be always extenuating circumstances why someone coming into your ER for healthcare might have a psychiatric disorder or something else, but to at least let people know, hey, we take this seriously. We take the lives of our healthcare professionals seriously, and we're not going to play games here. So if you're coming in just to cause problems, you need not to be here. That's kind of what that SAVE Act is about.
Especially with the topic of burnout in the healthcare industry amongst all workers, whether it's physicians, nurses, techs, CNAs, everyone. The topic of burnout has become a very prevalent one, especially since the pandemic, where we've seen spikes in suicide rates, spikes in just dropping out of the industry altogether, which contributes even further to the shortage and then furthering the burnout cycle for everyone else that's left in the industry. And it's like, it should not be expected to have to deal with verbal or physical or even emotional abuse at the workplace. And I think one of the stats that we had was at least 40% of all emergency department, basically personnel, experience violence of some sort at the workplace. And I'm friends with two people basically at LECOM who worked as EMTs, and they both said, oh, we think the number is so much higher. And I worked at the ER unit as well. And even before that, I worked in like the trauma ortho unit. And it's like across all of the different units, there's still like some baseline level of violence, which should just be unacceptable. And it's unfortunate that it is expected as part of the job and that it's something that people have to consider when, once again, going back to trying to decide which specialties that they should go in. People will literally look at ER and think, I don't know if I want to deal with all of that on a regular basis. And it's unfortunate because we need those people in those departments. They're essential. And then another important part about that act that I think was a very good point to basically add as part of the federal protections that we were asking for was also protections for people that commit or like involve themselves in acts of abuse or violence who have these like psychiatric issues or like specific disabilities, because we also have a justice system where a lot of times people who are suffering with those issues don't get the right treatment and then they're just treated as a criminal. And that also doesn't help the issue because we're not taking care of those patients. So it's like balancing protecting our healthcare workers and also advocating for proper patient care so that we can help them get better. Make sure that we're not putting other people, whether they're in the healthcare industry or within, the justice system, at more risk. And of course, the patient themselves. Marissa, is there anything you'd like to add about that?
I think that's such an important part because when Dr. Rupp was comparing that we want the same criminal justice that airline pilots and flight attendants receive, it's that we are medical professionals and, things happen with people who are having, psychiatric symptoms, but we will be better at, knowing the signs and taking care of them the right way. So having this in place is going to protect not only healthcare workers, but also those who are experiencing those symptoms and know that they will know the difference better, knowing that this person is acting voluntarily versus this person is, going through something and that we want to hold charges against them. We're just going to make sure that we know that we're taking care of them because in the ER, there are a ton of policemen. At least I worked in the ER in Philly, but there are a ton of them around there and they're always by the doors, especially if someone has a psych complaint. So just having that extra little care for the patients too, it's not just about healthcare providers, although again, with burnout and everything, it's very important. But, it's saying that we recognize that psych issues are very prominent and that being able to recognize that into this bill is taking a forward stance into taking care of them as well.
So at this point, shall we pivot over to our act regarding Medicare, which I said it earlier, and I just want to make sure that I'm saying the right number. I'm pretty sure it's HR 2474. So that was our last act that we were advocating for this year. Marissa, would you like to start us off in introducing that?
So I actually did present this to, I believe, Brendan Boyle's staff, myself as a statistic, but I'm not the huge, big finance number person, so I'll dumb it down into my level here. But basically, again, going back to rural communities, there are, with Medicare reimbursements, there are stats showing that their physicians are getting reimbursed at a lower rate despite having fee-for-services payments going up, as well as the cost of medicine and cost of treatment in general. There's a huge disproportion between reimbursement and service. And then that goes into play as if physicians can keep opening up their business in rural communities, or if they can, still provide care for those Medicare patients, which so many people in America depend on. So this act kind of reintroduces, is it MEI?
Yeah. So the statistic I can clarify for you. Yeah, I got you. DOs together. So basically, we have the Medicare Economic Index, which is the measure that they use to, I believe it's measure and state the percent change in the price of costs of healthcare provisions and such. So this includes payment for equipment, treatments, procedures, staffing, all of that stuff. And it compares it to how much physicians are being reimbursed at the annual level. And so the stat that we were provided, which we had discussed with a lot of the congressmen, was that the MEI had increased 48% since 2000 to 2022, and the reimbursement rate had only increased by 12%. So basically, we're at a point now where it's a lot of physicians are losing money by taking on Medicare patients, which is not very helpful for both the physicians that have to suddenly make this choice, which Dr. Roth can elaborate on, and also for the patients themselves, because we have, a very significantly aging population that needs treatment, but suddenly we're unable to afford to treat them. That needs to be fixed.
Right. By having that discrepancy in reimbursement compared to the cost of running a practice, it drives people to not have a choice of being a private practitioner, which is a big reason why a lot of people go straight to being employed by these large systems. The large systems are a little worrisome to me because there's a lot of private equity involved there, and I'm not sure that they're so altruistic as the people who are actually taking care of the patients.
Gets a little more businessy.
Just a little. I don't really like the trend, and I think it's not a good thing for patients overall. In my own practice, I am private practice, but I'm coming to the point because there's such a discrepancy between my cost of operation are going up so much and my reimbursement is so low that I'm contemplating, do I need to tailor my practice and which patients I choose to allow to come see me, which is just ripping my heart out because that's not what I'm here for. I want to take care of everybody who needs me as long as I can fit them on. But it's then coming down to the conversation of, do I join one of these big conglomerations, or how else can I keep my doors open? Basically, it really shouldn't have to be that kind of an edge.
And just to add on to that, I remember one of our team members had also explained how when we get to the point where we have to make those decisions, part of it is also taking care of us. As a practicing physician, we may have families, we have a specific baseline income that we need to make just to take care of ourselves and our households. And when we don't have these proper reimbursement rates, it's you're also accelerating burnout because suddenly you have to take on so much more just to make how much ever you need to stay afloat, to keep your private practice afloat. And it's just a very complicated problem because you end up with patients that just aren't being taken care of and physicians that are really upset with the choices that they have to make. And as DOs, because we serve a very underserved population, as we've brought up a few times now, it's those communities that are basically getting hit the hardest when a practice has to shut down or be acquired by a larger corporation that might not necessarily prioritize those patients that are coming in on Medicare who have the same, if not slightly more aggravated problems because they are an older group of our patients. Is there anything else that either of you would like to add on for the Medicare or even any of the other acts?
I think you covered it nicely.
All right. Well, this will be posted to YouTube, so if anyone wants to ask questions about any of the acts, we can always try to come back and respond to, whatever questions people have about them. After all, like a big part of DO Day and Nom Week is to educate people. And is there anything that you guys would like to talk about in relation to Nom Week? I can start us off by saying that at my campus here, Lecombe-Seton Hill, we had a lot of activities for Nom Week. Basically, we had a couple different people coming in to talk, a lot of activities just related to being DO proud. And there was like a bingo card thing where you could like educate yourself more about osteopathic medicine and the things that we stand up for. And you can check off these different things to just like use it as a week and an experience to like further your own knowledge and involvement. So Marissa, you seemed very excited at the Nom Week mention.
Well, I've been living in a box because of board studying recently.
Oh, yeah.
I can't really say what my school has been doing, but I know their clubs are very active, especially with the DO Day on Service, which was on Saturday. A lot of clubs got together to do some kind of community service event. But I just wanted to say that if you are a DO student listening, or if you are part of POMA, or in any way possible that you can get involved with DO Day on the Hill, please do. I think people just don't know about it. I know it's a best time of year, at least for second year students, but like contact your SOMA, or mine was a DO council, so SGA, and see what you can do to go. You'll never get anything like it. And I think if you continue on the route of advocacy, you'll make yourself more aware of the changes in the world and therefore make yourself a better position. Yeah, make the world a better place, honestly, truly. Like, this is one way of many that you can really make a difference in the world.
Being a medical student, being a healthcare worker of any type is challenging. It's hard, vigorous, I might even say, but we just have to stick through it and find ways to really make it as meaningful as we can while juggling everything that's going on. I didn't know a whole lot about DO Day before I got involved, and now all the team members that I'd talked to, everyone that I talked to, were like, oh, we're coming back next year, so we're gonna try our best. Yeah, it was a fantastic experience. And also it's like a great networking opportunity, because like we talked about, you just get to meet so many people. And like one of the best parts as a medical student was meeting actual doctors that were practicing, like Dr. Roth, and getting to talk to them about their own passions, how they got to the specialties that they were interested in, what their experiences were on rotations, residency, just how they navigated their own careers. Like, there's nothing like talking to those people in person, especially with everything that we've gone through in the last couple of years, going to school during pandemics and such.
I'd like to just say, yeah, I am completely empowered by having gotten to spend those days with the students that I got to spend them with. You guys are amazing. For anybody who's pessimistic out there, you need to get your optimism on, because this generation coming up is fantastic. And I would also like to give a shout out to all the attendings out there who have not participated in DO Day on the Hill. It's a couple of days. It's disruptive to your practice, but if you're not part of the solution, you're part of the problem. We all need to stand up, and things only happen when you do stand up and join together. And this is a great way to do it and meet awesome people of the future too.
I think that's a great point. There's a lot going on in the world all the time. And especially with, I think, our generation just like being so chronically online and always exposed to every single little thing, it's like it gets really overwhelming. And it's like we want to help. We got involved in this profession for a reason. It feels very hard to get involved and to make a difference while we're still in school. And as Marissa is studying for boards, which feels like so much.
I'm just going to say it's important to remember your whys and to develop new whys as you go along, because medical school just gets harder. And then,
it's hard to make that impact when you're on your own, but we are not on our own. We have our community of physicians, of healthcare workers, of just all the medical students and all the attendings together. We can make a huge difference when we're working together. So the first step is just showing up, just making your voice heard, taking these opportunities as they come.
And speaking of opportunities, I will take this one to also put a plug in for POMA itself. As students, interns, residents, and attendings, POMA has a lot to offer to you. And I really believe POMA is what you make of it. And so the sky's the limit. If there's something you want to see happening, be the seed, bring it to us, and we'll be happy to work on it too. We're here for our community.
So with that, I think we're going to wrap up. Thank you, everyone who listened and everyone who watched. And thank you, Marissa and Dr. Roth, for joining me today and showing up for POMA, for DOs, and for our patients everywhere.
Thank you with that.
Bye-bye.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts, and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.